the 6th of July, and the overall percentage testing positive was 11.8%. As of the 7th of July, South Africa has 10,144 new cases, bringing the cumulative confirmed cases since our first case to 215,855. To date, 48% of the confirmed cases have recovered, bringing the total to 103,934. Unfortunately, over 3,500 have been confirmed deaths. This brings us to the case fatality of 1.6%. The Western Cape continues to have the highest number of confirmed cases at 72,156, followed by Gauteng at 71,488, Eastern Cape at 40,401, and KwaZulu-Natal at 16,743 confirmed cases. We however expect that Gauteng will be the highest number of confirmed cases when we next make the announcement, making it the epicenter in the country. We have used a differentiated approach in our response through a classification of districts as areas of low transmission or vigilance and high transmission, or what we call hotspots. In all the areas, the focus continues to be on the prevention of new infections, containment, mitigation, and recovery. The overarching objective is to strengthen the national and provincial mechanism for detection, management, and containment of the spread of COVID-19 with 9 overarching strategic priorities or pillars, which are the following. One is providing effective governance and leadership. 2 is strengthening surveillance and strategic information. 3 is augmenting health systems readiness by assessing health systems readiness against the epidemiological curve, identifying the gaps and planning to ensure services availability according to the need, focusing on the workforce, health workforce, beds, medicines, equipment, and products. 4, enhancing community engagement by ensuring effective communication to the public and improving laboratory capacity to test by strengthening the national health laboratory services, as well as the private laboratory capacity for testing COVID-19 to meet the requirements of the response and improve the coordination between the public and private sectors. And clarifying care pathways in respect of case detection, management, and clinical pathways, and to align the hierarchy of facilities established or reconfigured for COVID-19 response, and scaling up infection prevention control measures, and strengthening capacity at ports of entry by enhancing screening capacity at the key entry points, and expediting research and introduction of therapeutics, diagnostics, and vaccines by institutionalizing mechanisms for COVID-19 related health products, regulation and research coordination, and building mechanisms for ongoing learning from research and experience from other countries. Between level 4 and level 3, which is June 1st, the number of COVID cases increased across the provinces. During level 4 of the lockdown, the Western Cape, Gauteng, Eastern Cape, and KwaZulu-Natal had the hotspots using the number 5 per 100,000 population of positive cases. This was our case definition, but of course, later on at level 3, these 2 additional provinces, namely the Northwest and Free State, also registered hotspots. Due to these increasing numbers, this definition will be improved and is going to be changed to take into account the increasing transmission, as well as the readiness of our hospitals, our beds, our human resources, and other products. With regards to quarantine, as of the 7th of July, we activated 139 quarantine facilities across the country, which constitute a total of 12,532 beds. Community screening and testing program initiated on the 7th of April has ensured that more than 20 million people have been screened and 302,000 suspected cases were referred for testing. Screening in identified hotspot areas and emerging hotspots show that this program of screening has assisted in active case finding amongst high transmission communities, which has allowed our provinces to divert resources to the district or sub-district level. As on the 30th of June, 4,821 health workers were reported to have been infected with COVID-19 virus across the country. This data represent cases of health workers in both public and private sector, with the Western Cape continuing to account for the majority, which is 68% of healthcare workers, with 3,285 infections as on the 29th of June 2020. The leading number of infections are amongst the nurses, with 2,474 infections, followed by other health professionals, including community health workers, reporting 1,971, and doctors recording 377 infections. At this point, I do wish to pause to pay tribute to all our gallant heroes, those health workers who are out there saving lives and braving it all to face the difficulties of risking their own lives being infected, but they have gone all out to save the lives of South Africans. I'd like to say that those are our heroes. We salute you as health workers, and we really appreciate your dedication and commitment to the calling of caring for the nation. Several interventions have been put in place to address the infections among healthcare workers. Guidelines to support all healthcare workers across the continuum of healthcare of care were developed. A targeted training program was designed and implemented to enhance their understanding of the pandemic and facilitate application of these guidelines, which are primarily including infection prevention control, as well as case management. In-service training of all healthcare workers to ensure that workers can cope with the management of the pandemic relative to the scope of work has also been initiated. Occupational health and safety workers and visitors and clients is an important aspect of our response to COVID-19 as we unlock the economy. Department of Health worked closely with Department of Employment and Labour, and through NEDLEC, drafting a consensus document on workplace intervention in responding to COVID-19 and to ensure that the health and safety of workers. We also provided guidelines covering risk assessment in workplaces, symptom screening and testing of workers, psychological support interventions, disinfection of workplaces, and return to work assessment. PPEs, personal protective equipment, is specifically required to protect healthcare workers and other frontline workers from COVID-19 infection. Since the pandemic started, PPE supply chains have become severely constrained both globally as well as inside the country. Limited imports and shortages of raw material adversely affected the local production. Through the generosity of donations made by South Africans, the Solidarity Fund was able to commit a total of 815 million towards procurement of urgently needed PPEs for the country. The country also received generous donations of PPEs from several countries, foundations, businesses, and churches. We are happy that Solidarity Fund has indicated willingness to support immediate distribution of PPE in its position to various provinces. This will greatly assist us in closing the gaps in various provinces where there are stockouts on some of the PPE items. The rational use of PPEs is the greatest challenge facing us during this pandemic. Healthcare workers, labor unions, professional associations, due to the concern for safety for themselves and their members, are expecting to be provided with full PPEs or full spectrum of PPEs. In determining the PPE requirement for the healthcare workers, we're guided by the advice from the infection prevention and control experts. We want to assure frontline healthcare workers that PPE requirements for health workers will, at different levels of risk, will be informed by this evidence. Our assessment as of 7th of July is that we have sufficient PPE stock available to meet the requirements of frontline healthcare workers. We endeavor to ensure the appropriate PPE is made to protect the frontline care workers from getting infected by coronavirus. We have to work very closely with the unions and our management to make sure that the distribution is appropriate so that no one feels they are left unprotected. Our NICD and our Department of Health have provided a clear guidance for local clinicians and have updated that advice as evidence has emerged. In selected hospitalized patients, a short course of the drug dexamethasone can reduce deaths from COVID-19. The injectable form of this medicine is available in the country and will immediately be used in selected patients. And another drug that's also been used for COVID-19 patients is called remdesivir, which is used in clinical trials. I must say that the positive news of this nature has really given a lot of encouragement to our clinicians, because at least now there's evidence that there's some benefit on the use of these drugs. As much as we look forward to an effective and safe vaccine and to do more effective therapies for COVID-19, current clinical management relies mainly on supportive measures, including provision of oxygen. South Africa has a well-developed medical oxygen supply system, but careful planning and management will be needed to ensure that every patient who needs oxygen is able to access it. Since the last release of scientific model results on May 2020, the national COVID EP model has been updated to model COVID-19 at a district level, making use of South African hospitalization data, updated estimates of the reproductive number, and a shift in testing priorities. Current model projections indicate that while the epidemic is predicted to peak nationally at a similar time to the previously projected optimistic curve, that is mid-August, June, that is July to mid-August, it will do so, however, at a lower level. This means that fewer people were infected in May and June than was previously initially predicted, even under the optimistic scenario. While the model projects a lower need for hospital, non-ICU and ICU beds at national level, bed capacity is still expected to be breached or overwhelmed in all the provinces. Currently, planned hospital beds in the Eastern Cape and Gauteng are projected to be insufficient for combined non-ICU bed demand and the overflow of ICU once ICU capacity has been breached. Bed capacity, including all currently committed public and private sector beds, is expected to be breached in the next 4 weeks. The Department of Health has developed and is implementing the surge strategy in an anticipation of the peak. This will ensure that the department increases capacity for COVID-19, while at the same time continuing to deliver our other health services to the healthcare users. During this process, the department repurposed a total of 27,467 beds for COVID-19, which has increased to 40,309 beds as the provinces started to experience a sudden increase in the number of cases. It is important to keep this balance here because we have also got indications of concern that the numbers of people who are coming for treatment for HIV, TB, and other diseases has been going down, and therefore we need to make sure we balance it up so that we do not have a problem of increasing fatalities due to the comorbidities. The Department of Health is working with the Department of Trade and Industry and Competition to manufacture continuous positive air pressure devices, which are called CPAP for short. Through this arrangement, the Department of Trade and Industry has mandated the South African Radio Astronomy Observatory to manage the national effort required for the local design, development, production, and procurement of the respiratory ventilators to support the government's response. These are being procured on top of the 1,000 ventilators generously donated by the US government. The Department of Health has built several field hospitals, which will primarily be used for admission of mild cases. The Western Cape has completed construction in 3 field hospitals, which are functional, in Gauteng, in Nasrec, KwaZulu-Natal, in Pietermaritzburg, and eThekwini. The Eastern Cape in Port Elizabeth. Each one of these field hospitals are also now operational. The department is working with National Treasury and partners to conduct an audit of the oxygen reticulation infrastructure in all the hospitals. These audits are being conducted with priority focus on the Eastern Cape, KwaZulu-Natal, and Gauteng. The outcome of the audits will give us a sense of the amount of work needed to be done to address the gaps and undermine the expanded supply of oxygen to patients. We are already in touch with the manufacturers to be able to switch the use of oxygen from industrial use to increase for health for the health services. Honorable Chairperson and honorable members, before COVID-19 landed on our shores, we looked at the rising numbers in various countries with wonder. But now, it's no longer a matter of announcing numbers of confirmed cases. We're now at a point where it is our fathers, our mothers, our brothers and sisters and close friends and comrades that are infected. We feel the sadness of for every departed soul, and we share the anguish of the grieving families and friends. COVID-19 now has a face, a name, a family, and a house address. Now, very few South Africans have not been directly touched by the effect of COVID-19. As a country and the world at large, we're now in this reality where we must live with knowing that some of us cannot even bury our loved ones because of restrictions and even because we ourselves have been exposed. The pandemic that is attacking us globally will cause some of us lifetime scars. It steals from us, from some lives, from others' jobs, others' businesses. It is affecting literally every part of our lives. It spares no race, no gender, or social class. So, Honorable Chairperson and honorable members, we have now reached the stage. The storm that we have consistently warned South Africans about is now arriving. As a nation, we have every reason to be united in this fight against COVID-19. We dare not be divided. As a government, we have said we cannot fight COVID-19 enemy alone. We need all political parties, social partners, and every citizen to come on board. As we continue this battle, we look beyond our differences and ensure that whatever we and those around us change our behavior and observe all the measures announced to contain the spread of the virus. We must do so with a conviction that we have a duty to not only protect ourselves, but those around us. In the end, united, we will overcome. Thank you very much.
Thank you very much, Minister of Health.
Please mute your mics.
Switch off your.
Those that are at home, please mute your mics. After this, I feel I must remind all of us in the House that we need to put on our masks fully. Unless you are speaking, you can remove it. It's a plea that I'm making. Please. Mekharube, you are next.
Honorable Marube, you are next.
Mokaneng, please mute your. Thank you.
Chairperson, it would be amiss of me to not extend heartfelt condolences to the family and the friends of those who have lost loved ones during this pandemic. In the past 4 months, the country has experienced one of the most destructive and deadliest pandemics in recent history. As we gather here today, there are people who are languishing in hospitals, fighting for their lives in their homes, and over 3,500 people have lost their lives. To many, these are not just fatalities. It is a family member, it is a friend or a colleague. All the while, healthcare workers are throwing their bodies on the line, working in the most impossible conditions. Siyababulela ngomsebenzi wabo, izinqe zabo ziyavakala. However, in our strategy of fighting this virus, we cannot simply be hoping for the best. Government strategy has to be grounded in concrete plans which will force the curve of infections down. This begins with proper resourcing of the health response in order for us to ensure that provinces are ready to handle the rising numbers of infections. so that those who require medical help are afforded a bed and that is fully kitted and staffed with the requisite equipment. This is not being fully done. The Minister of Finance tabled the adjusted budget 2 weeks ago, which painted a grim picture. The announcement that was made by the President several weeks ago of the 20 billion rand allocation turned out to be a reprioritization of existing provincial budgets. Simply put, provinces are now forced to find money to fund their additional needs using existing conditional grants meant for other services. The President has repeatedly stated that money should not be an obstacle and that government will make available financial resources that would build field hospitals, that will appoint additional healthcare workers, that will fill critical vacancies and provide life-saving PPE for healthcare workers. This is not being done. Additionally, resources can only assist where there are strong systems in place. Without competent administrative and political leadership, these resources will be squandered. This pandemic found the country's health system already on its knees. It is now dissipating even the parts of our system which were salvageable. The Department of Health should have taken the lead on stress testing provincial systems, augmenting them and ensuring that our preventive strategies were sound. Make no error, the explosion of cases isn't just because of an inevitable health crisis. It is also because our prevention strategies were found wanting. When we gathered here to debate the state of readiness for the coronavirus pandemic on the 5th of March, I pledged our conditional support to government efforts to fight this virus. We vowed to stand by you as long as you place the well-being of South Africans first. That was the condition. It was never a blank check. It was always about the people that we serve. You have let them down and we have withdrawn our support. The social contract that South Africa signed with its government was clear.
Honorable members.
Supporting us, they're not supporting. The minister has just spoken really, and you
on a point of order.
Order, honorable members on the virtual platform, please. Order.
Chairperson,
Yes,
on a point of
Honorable
order.
Faber.
Chairperson, this is not the first time that Honorable Zulu has been interrupting. It's been going on for a few times on virtual meetings, and I would like you to please mute her.
Thank you. Honorable members on virtual platform and in the House, I'm not saying this for the first time, and I really want to plead with you. We shall observe the rules of the sittings of the National Assembly, because the rule says you cannot just speak without being recognized. So if you switch on your mic, you are definitely doing something which is not allowed by the rules of this House. And it's unfortunate that you are not here, and if you mute you, we will mute people who are supposed to speak. Please, please bear with us. This is a very important topic that we are discussing now. We don't need the interruptions. Thank you, Mekharube. Continue.
The social contract that the South African public signed with its government was clear. They stayed at home at the expense of their lives and livelihoods, and government would build health system capacity. That contract has been breached. Government has failed to build healthcare capacity and uphold its end of the bargain. Minister Mkhize, the analogy that you make about the storm that is coming suggests that we are merely subjecting ourselves to destruction as we are seeing across the country, as though we are lambs to the slaughter. That is simply not good enough. If we have a fighting chance to save lives, then urgent steps must be taken to arrest the freefall. These steps need not wait for more lives to be lost. They require the political will and strong systems to be placed in place. They can be done today. Number one, you can begin by placing the Eastern Cape under administration, according to Section 100 of the Constitution. The Constitution makes it clear when a provincial department cannot fulfill its core mandate, Section 100 intervention must be used. The Premier of the province has admitted that they've lost the battle against this virus. Hospitals in the province have long reached full capacity. Healthcare workers are getting infected, and those who are left to hold the fort are doing so at a great cost to their lives. People are fighting each other for mere oxygen. All the while, the provincial government invests tens of millions of rands on glorified scooters that you personally endorsed. Secondly, you can go back to the drawing board with National Treasury and commit funds to provinces so that they can begin mounting a decent response to the pandemic. Places like the Nazareth facility, which you mentioned, will become white elephants if they are not staffed or well equipped in a way that can save lives. Simply putting in beds is but the beginning of the process. Thirdly, money that is allocated must be accompanied by strong operational plans and strategies per province. It is simply not good enough to wait for the explosion of cases, then it might be already too late. These plans must make provision for additional critical beds, additional staff, testing and tracing capacity. This must be done even if it means setting up a parallel system that bypasses the dead wood in some of these departments. This is not the time to choose political allegiances. This is the time to save lives. Lastly, without adequate contact tracing, sibethwa sibochelelwe. Much fanfare was made about making use of cell phone location services, which will be used in conjunction with the community health worker program. This seems to have been a non-starter. With results taking up to 10 days to be communicated back to people and virtually no contact tracing being done, we are failing. We are only at the beginning of this battle. Testing, tracing, and tracking must be the cornerstone of government strategy. Minister Mkhize, we may not have been able to prevent this pandemic from arriving at our shores, but we can minimize its destruction. We can save lives. These are interventions that you can make today to stop the bleeding. However, you have to have the courage to choose the people of South Africa over what may be politically expedient. You have to make the difficult choices.
On virtual platform.
Thank you very much, Honorable Member.
Yes, thank you very much, Chair.
Oh, Gwen, okay. Thank you. Continue, ma'am. Continue.
Okay, thank you very much, Chairperson. In times of crisis, the real leadership sometimes emerges, Chairperson. This kind of leadership is able to steer nations across troubled waters. It is able to inspire hope. It never leaves the nation unattended, and it's never an impression that it is everyone for themselves when nations have real leadership. The corona pandemic has exposed in such a dramatic and painful manner that this country does not have that kind of leadership at a state level. And that perhaps we never had leadership at all for a very long time. Today, South Africa has over 216,000 known cases of corona, almost 4,000 people have died, and we get at least 10,000 positive cases per day over the past week. And in April, when Italy was at its peak, it had about 129,000 total cases of COVID, and their daily infections were around 6,000 on average. You and the expert minister that we have around you claim we have not even reached the peak of the virus, yet we are averaging 10,000 cases a day. What this means, therefore, is that when the storm you consistently speak about, we may see death and carnage of apocalyptic proportions. South Africa will be a case study of how not to manage a pandemic. Unfortunately, some of us may be death statistic by the time this pandemic is over, if it will ever be over. We do not have the hospital capacity, Minister, to deal with this. We do not have enough trained healthcare workers. We are not testing enough, and our capacity for contact tracing is pathetic and almost non-existent. In the midst of all of this, Honourable Minister, you have reopened, you and your president have reopened everything in the economy using this Trumpian logic that the virus will only kill a few people. How many people must die for you to be satisfied that this is a serious virus? If one death is not enough, then how many more deaths must happen? Why are we not bothered to say the only people at risk of death are those with comorbidities? You have indicated that people with diabetes, for instance, are at greatest risk. Well, in this country, we've got over 4.5 million people that are living with
All right, apologies on that link. We seem to have lost it. Well, we heard the minister responsible for the Department of Health, Dr. Zweli Mkhize, making a statement really on the impact of the COVID-19 in the country, giving out the numbers in terms of the positive confirmed cases, in terms of the deaths that have been recorded, in terms of the recovery cases, going province by provinces, talking about strengthening laboratory services to speed up testing capacities, talking about hotspots, and basically saying that before the lockdown, your Western Cape, Gauteng, and the Eastern Cape had been identified as hotspots for COVID-19. So he says that this definition of hotspots will have to be reevaluated and re-looked in certain aspects to be brought. So part of what the minister also said is that fewer people were infected in May and June than it was previously predicted. So now what you have are members of parliament from the different political parties debating what the minister has just said and also giving their response to the state of affairs when it comes to COVID-19 here in the country. So we'll certainly be taking you back to parliament as soon as that link is up and running. Is it up and running? All right, so I'm told to take a quick break. We'll be back shortly.
patient, and we'll revert back to you within the next few minutes.
We can proceed. We can take the next speaker from the IFP. IFP.
Who's that now?
Honorable Chairperson and honorable members, it is with great sadness.
Honorable Ngobo,
Because there is
Jama noluvuyo tafeni. Jama kancane nje sizoyilungisa indaba le nje ungathi iyalunga actually. Okay, honorable members, I think we are back, we are connected. I just want to go back to Honorable Mautwe. Honorable Mautwe, if you can hear me, you were muted when you were left with 2 minutes 49 seconds. The people on virtual platform could hear you, but the ones in the chamber could not. So I'm not sure where you're gonna start to make sure that you are 2 minutes 49. So I'm not sure where you're gonna start to make sure that you are 2 minutes 49 seconds of speech is heard.
House Chairperson.
Yes, sir.
Can Honorable Maut start from the beginning so that it is a seamless, understandable speech, because in that way there will be a problem.
It's not going to happen.
No.
Order, honorable members. I know.
The mistake is made by you.
Order, honorable members that are just switching on there. I have to respond to Honorable Shibambu, please. Honorable Shibambu, I'm going to allow Honorable Mautwe to continue from where she left off. Honorable Mautwe, please switch yourself on.
Honorable Chair, I'm on, but I get now and then be muted by the host. Can I be respected as a member of this house, please?
Honorable Mautwe, maybe you did.
I'm being muted. Please, talk to your people.
Honorable Mautwe, can I respond to that? It's not a treatment to you. We were all disconnected. You were speaking, but unfortunately, Ceci, we could not hear you. So that's why I'm coming back to you to say continue. You still have 2 minutes 49 seconds. Can you do that for us?
Yeah, I will, but it's very difficult to start it because I don't know where you last heard me. So I want to agree with Honorable Shibambu that perhaps I start from the beginning and maybe you can just give me an extra minute to finish if I don't finish on time.
That's fine, yeah. Let's proceed like that, TG, and then we'll proceed. Let's start from the beginning.
Okay. Chair and Honorable Shibambu, thank you very much.
Continue,
Shibambu,
Mama. No, I have my time.
Hey,
don't worry.
Allow the TG to speak. TG, speak.
Oh, Kosiam. Ma'am, thank you. I'm still trying to resolve. Ma'am, Mautwe, speak. Speak. Speak, Honorable Mautwe.
Okay. Chair, it is during times of crisis that real leadership sometimes emerges. This kind of leadership is able to steer nations across troubled waters. It is able to inspire hope. It never leaves the nation unattended. And there is never an impression that it is everyone for themselves when nations have real leadership. This corona pandemic has exposed us in such a dramatic and painful manner that this country does not have that kind of leadership at a state level, and that we perhaps have not had the leadership for a very long time. Today, South Africa has over 216 known cases of corona. Almost 4,000 people died, and we get at least 10,000 positive cases per day over the past week. Only in April, when Italy was at its peak, it had about 129,000 total cases of COVID, and the daily infections were around 6,000, sorry. You and the expert minister that we have around you claim that we have not even reached the peak of the virus, yet you are averaging 10,000 cases a day. What this means, therefore, is that when the storm you consistently speaks about, minister, we may see death and carnage of apocalyptic proportions. South Africa will be a case study of how not to manage a pandemic. Unfortunately, some of us may be death statistics by the time this is over, if it will ever be over. We do not have the hospital capacity to deal with this. We do not have enough trained healthcare workers. We are not testing enough, and our capacity for contact tracing is pathetic and almost non-existent. In the midst of all this, Minister, you and your president have reopened the economy using the Trumpian logic that the virus will only kill a few people. How many people must die for you to be satisfied that this is a serious virus? If one death is not too many, why are you not bothered to say the only people at risk are those with comorbidities? You have indicated that people with diabetes, for instance, are at greatest risk. Well, in this country, let me tell you, we've got over 4.5 million that are living with diabetes. Is it okay if these people die? We have on various occasions argued that we must reimpose hard lockdown because failure to do so will be catastrophic. It is possible to do this without endangering people's lives, and you ignored us. We have said that there must be an interest-free suspension of loan repayments until we have passed the peak of this pandemic. You ignored us, and now people are forced to expose themselves to danger because they must service their loans, otherwise their assets will be repossessed. We have argued that schools must stay closed until we have passed the peak of the pandemic, Minister, and you ignored us. And now teachers and children are infected in their thousands. We have argued for banning of the sale of alcohol, and again you ignored us. And now hospital beds are taken up by people injured while under the influence of alcohol or those injured by drunk people. We have asked that you must release a rectal breakdown of COVID infections and death. You ignored us because deep down you know that it is black people who die in their numbers. Where if white people, you would not be as careless as you are. Your government's deep hatred for blacks is unparalleled, Minister. Minister, you have reduced yourself into becoming a COVID statistician general, releasing statistics while doing very little to protect the lives of our people. History will remember you, and it will not be very kind, Minister. Children offended at any age will remember that your government had a haphazard attitude to the virus as being primarily responsible for the death of their parents. Mass graves of poor, helpless black people will be a timeless testimony of a government that had deep hatred for black people. I thank you, Chairperson.
Thank you very much. Thank you. Honorable Ngobo, you are next.
Thank you very much. Yes, thank you very much, Honorable Chairperson and Honorable members. It is with great sadness that we note the passing away of Mr. Gordon Kekakilwe, the Northwest MEC for Cooperative Governance, Human Settlements and Traditional Affairs, due to the COVID-19. On behalf of His Excellency Prince Buthelezi, our President Emeritus and Leader of Parliament, and the entire IFP Parliamentary Caucus, we extend our deepest condolences to Mr. Kekakilwe's family, colleagues and friends. And yes, Honorable Minister, you were quite right when you were addressing the House that this is no more about numbers. It's about our loved ones leaving us. Honorable members, extreme poverty, inequality and violence have always been part of the fiber of our society. The COVID-19 pandemic has been a catalyst for the explosion of these issues, which have been simmering beneath the surface for decades. Upon the announcement of the national lockdown by President Ramaphosa, the IFP supported the intervention and in solidarity committed to donating 500,000 rand, that's $500,000, to the COVID-19 Solidarity Fund. The IFP, however, remains concerned about the surge in the positive cases recorded, especially in Gauteng. And of course, no other province is safe anymore. And on July 7, the number of positive cases, according to the National Institute for Communicable Diseases, stood at 205,721. And Gauteng alone had 66,891 positive cases. In the wake of this surge in numbers, the IFP has called for the reinstatement of level 5 in Gauteng and remains concerned about the healthcare facilities and schools becoming hotspots for virus. In April, the IFP appealed for urgent investigation into the outbreak of the virus in KwaZulu-Natal private hospitals and asked the KwaZulu-Natal MEC for help to ensure that all the healthcare workers were provided with adequate personal protective equipment, PPEs. According to the South African Nursing Council's 2017 age statistics, close to 50% of all registered nurses and midwives practicing in South Africa are over the age of 50, making them particularly vulnerable to virus. At this critical stage, we cannot overemphasize the need for detailed prevention plans to be implemented by our provincial and national health departments. The supplementary budget proposes an additional 21.5 billion rand to be made available for health, and 16 billion rand of which will be transferred to the provinces. It is crucial that the public be informed of how this money will be allocated and that it be supported by detailed prevention strategies to ensure that no resources are squandered. The IFP believes that the phased-in approach to the reopening of schools was ill-informed and contributed to the surge in the number of positive cases. On 26 June, the IFP called for an urgent debate on this issue in Parliament. We question the rationality of the phased-in approach and the inflexible decision to continue with the matric examinations in November. We demand careful consideration of all alternatives to ensure that the well-being of our children and teachers and their families. In conclusion, the IFP stands in solidarity with South Africans. Thank you, Chairperson.
Thank you. Mhlonishwa van Staden in the chamber.
Geachte voorsitter, die Vryheidsfront Plus wil graag van hierdie geleentheid gebruik maak om Suid-Afrika se dokters, verpleegsters en alle gesondheidswerkers te bedank vir hul onbaatsigtige dienste wat hulle lewer in die stryd teen COVID-19. Chairperson, it is sad to say that the public health sector has reached its dying day and COVID-19 is not the only cause of death. With the first level 5 lockdown in March this year, it was evident in an early stage that the public healthcare sector was not ready for the wave of COVID-19 patients. Yet South Africa has granted this government the opportunity during the level 5 and level 4 lockdown to ensure that the public health system was upgraded and brought up to standard to be ready for a massive wave of COVID-19 patients, flooding the hospitals and clinics for treatment. Yet this government failed to use this opportunity to do so. This government failed the people of South Africa and they did not prepare adequately for this, and now we have seen on a daily basis shocking scenes of healthcare workers who are on strike due to the shortages of PPEs. We have seen on a daily basis the shortage of doctors and nurses, as well as ventilators, hospital beds and medicines. We saw patients fighting each other over oxygen, patients lying on hospital floors, shortage of field hospitals, and if it was not for the private sector who pitched in and sponsored field hospitals in the Eastern Cape and Gauteng, the picture would have been darker than what we have seen so far. We saw on a daily basis that corruption is still taking its toll on the health department. We saw every day that instead of getting ventilators and extra hospital beds, this government is buying motorcycles in the fight against COVID-19 instead of adequate ambulance vehicles. We have seen COVID-19 tests found in the field next to the N2 in the Eastern Cape, putting people's lives in danger. Doctors and nurses are trying to do their work with the little they have. We have seen quarantine facilities that do not adhere to health and safety guidelines of its own health department. We have seen the rape of a 2-year-old COVID-19 patient in isolation in a hospital in Pretoria. This government is the only one to blame for the death of the public healthcare sector. All that COVID-19 has done is to choke the last little bit of oxygen out of this dying sector. If it was not for the private healthcare sector, who said from the first day and from the start of this pandemic that they are willing to help the government in this fight, we would have seen darker pictures already. Yet, this government is still trying everything in its power to get rid of a private healthcare sector and to replace it with the NHI. While scientists and doctors are saying to this government that the lockdown has already served its purpose and that further restrictions will not stop the spread of the virus, yet this government is still enforcing regulations onto South Africans that is busy destroying not only the economy, but the lives of all South Africans. We have reached a stage that people will not only die of COVID-19 alone, but also of starvation. We have reached a stage where South Africans will ignore all regulations. And I warn today that if you do implement more stringent restrictions, like going to Gauteng back to level 5, then you will see people cause utter chaos and clashes with authorities, and the people of this country will not accept another hard lockdown. In the light of new evidence from scientists that the virus is also airborne, moet daar nie eerder gefokus word op om die virus meer effektief te beheer en te bestuur nie. Daar moet nou proaktief gedink word en daarom moet daar nou meer as ooit geluister word na wetenskaplikes, mediese kundiges en kenners op hierdie gebied om gemeenskappe te leer van die nodige voorkomings van COVID-19 en om die nodige voorsorgmaatreëls te tref. Ons kan nie aangaan soos wat ons aangaan met die inperkings en regulasies wat ons het nie, maar dit gaan nie verder help nie. Dankie voorsitter.
Dankie agbare lid. Agbare lid Soekers.
House Chair, the Honourable Soekers is struggling to connect. Can we just try call her again? But she's been in and out. If not, then I will come to the front and deliver on her behalf.
As long as you can come before the speaker number 15. No problem. We'll
Can
continue.
you try? I think she's online now.
Oh.
I am on there.
Okay. Go on, Honourable Soekers.
Honourable Chairperson, vandag in hierdie mooi land van ons is daar 3502 families wat 'n geliefde verloor het in hierdie pandemie. As the ACDP, we extend our condolences to them in this very painful season of their lives. Out of those that have succumbed to the virus were also a number of health workers, men and women, who in spite of the threat to themselves got up every morning to tend to the sick and dying, and in their commitment to the high ideals of care, they paid the highest price. Our nurses and doctors are the last voices and form of physical presence of another human being for those dying of this virus. And for those recovering, they are the warriors that nurture them back to optimal health. We owe all healthcare workers, from the porter to the head of a unit, a debt because in a nation suffering under the weight of a fragmented societal compact and motivated by virtue to honor their vows. COVID-19 will not be successfully combated unless all of us armor ourselves with the same commitment and resolution to fight this disease and champion the health and wellness of our nation. COVID-19 has joined the list of enemy combatants such as TB, HIV/AIDS, heart disease, and diabetes. It just moves at a much faster rate. Our or any other health system in the world cannot be the sole defense against this pandemic, because the changes that are needed to stop the spread are behavioral and at a community level. In the words of a young doctor, healthcare is not at the front line of defense against this pandemic. It is the last line of defense. Community mobilization and reach to prevent a rapid spread and encourage adherence to safety standards was supposed to run parallel with getting our health systems ready. Our critical misstep was to focus on government interventions and not pull our communities in readying for the coming storm. Community cooperation and buy-in to the message and strategies of government is critical in our fight, if not the most critical. The health system in South Africa reflects the severe limitations of the state and the impact of corruption on the social compact between government and its citizens. Community transmission escalated as the economy opened up, and communities suffering under unemployment moved out of lockdown long before government announced the relaxation of its regulation. We are now paying the price of a deficit of trust by our communities in government and in the political apparatus. Open graves have now become the deterrent, but also the driver of anxiety and fear. Tackling this requires multiple efforts to reach communities with the right messages and align efforts across sectors. Every single leader in every sector of society should now become an educator, a messenger, and a mobilizer in the fight against this virus. I thank you.
Baie dankie. Mama Machau. Mama Machau.
Thank you very much, Chairperson. The unfortunate existence of the unprecedented pandemic that we are faced with as South Africa has unmasked many of the irreconcilable differences in the quality of life experienced by many South Africans, where we have seen hospitals running out of beds and people running out of resources for assistance with regard to the treatment of the surging coronavirus pandemic. I'm happy that the Minister has made mention of the challenges that this country is facing, like the capacity in some of the hospitals to deal with this pandemic, critical shortages of equipment and staffing, no contract testing in some areas and tracing capacity, the lack of testing laboratories. It's a problem that needs to be addressed urgently. Given an example of OR Tambo, district municipality in Eastern Cape, whereby you get few laboratories, so they have to use couriers sometimes, which are not at all reliable. So the minister must quickly address that. Again, I'm a little bit worried around the issue of the reopening of schools vis-a-vis the conditions of school infrastructure that we are facing, especially in the recent case, whereby you get schools with no water, with no toilets. I don't know what is the take of the minister around that, because it's where the contraction of this pandemic will be very high. Chairperson, coming closer to another point that we are facing in this country, we cannot talk about the coronavirus and not talk about the unfortunate dent it has left on the economy of South Africa, where new reforms have to be put in place to control and manage the further bleeding of the economy and ultimately job losses. The protection of the economy of South Africa to prioritize South Africa in all matters that relate to trade will help us increase income per household instead of creating citizens that are dependent on the grant system, which does not satisfy their everyday needs. The time to further the agenda of Put South African First has never been more necessary to ensure that the circulation of the economy serves the people of South Africa, the creation of job favors South African First, and the unburdening of the rising dependence on state funds for grant purposes is rechanneled towards reinvestment in the health sector for better facilities. What we are saying, Chairperson, is that how I wish that the minister can put time frames. I'm worried about the word audit at this point in time where we're about to reach a peak. How I wish that clear time frames can be put, clear focus can be on the Eastern Cape where the situation is bad in that province. Our fight is one, put South Africa first in their own land. Thank you very much, Chairperson.
Siyabonga ma'am. Mhlonisha inkosi uKwankwa.
House Chair, virtually yes. Thank you. Can I continue, ma'am?
Yes, yes.
Oh, thank you very much. As ministers, the United Democratic Movement, our concern has always been that we missed an opportunity, the government missed an opportunity to put in place or to implement a proper testing strategy during the period of the level 5 of the lockdown and, if you like, level 4 of the lockdown. That was a missed opportunity because testing currently is happening haphazardly. One of the issues which are a major concern for us as a party is that it seems like even contact tracing has completely collapsed. In some instances, people are told that you only, even though you've come into contact with someone who tested positive with coronavirus, those who come into contact are only told to go and test only if they have symptoms. Another challenge with that, obviously, as you're aware, is that those who are not symptomatic might end up spreading the virus to other vulnerable members of society without being aware, obviously, of those issues. We are still concerned, very much concerned about the fact that there seems to be a push by government to try and send more children to school, even though we are now, as you quite correctly put it, that's if I say a storm, which is a problem because it means that those children are going to go to school, contract the virus, and then bring it back home to people who have comorbidities rather. The other challenge that we find is that in hospitals that are collapsing, when you look at the entire basic healthcare system, in provinces such as the Eastern Cape, for example, where nurses have actually decided, or healthcare workers, I should say, have decided to be whistleblowers on areas where there's no leadership in those institutions, such as your Grey Hospital, your SS Gida Hospital, your Bisho Hospital. Those who come forward with information and feedback that could help to improve the quality of the healthcare that is being provided in those institutions are being targeted and victimized on a daily basis. And it's a challenge because there is no way that you can be able to implement a complex system such as this one without being able to get proper feedback from the people who are responsible for the implementation of whatever programs and strategies that you put in place. We're also concerned that now government has tended to focus more on providing us on a daily basis. If you like, it's important that we know about what's happening, but we're inundated with statistics at times without being given a global view or picture of how the strategies that are being rolled out, their effectiveness, and whether we are getting the desired outcomes, and whether provinces actually sharing, there's a province's students, are we having a discussion as Gauteng and the Western Cape to say, what have you done in order to manage to get the high level of recoveries that you're getting? Have we zoomed into different areas which were in the past hotspots? Look at Kailicha, for instance, where you look at the recovery rate and say, what are the people in Kailicha doing as opposed to other people who say, hypothetically speaking, in Soweto and other areas? Because once we start documenting the recoveries and following them scientifically to say what it is that is happening, we might be able to develop our own interventions as a country to say this is what would work when you have these symptoms, when an emphasis is along these symptoms, this is what works. I don't think we're having that discussion enough, apart from because so many people have died, so many. Thank you.
Honorable August, as you come in, Deputy Speaker, you can proceed. As Honorable August will be speaking from the virtual platform. Good.
Honorable Chair, the coronavirus is a new disease and medical experts around the world are learning more about the best ways to save lives every day. Politicians are not medical experts. We listen to doctors and scientists. In time, we hope to see a vaccine or a cure. Until then, we are told the best way to save lives is to flatten the curve. Although the virus is peaking now, there are many South Africans whose contributions to slowing the spread and bravery under fire on the front lines deserve rich acknowledgement. The President took courageous, proactive decisions. Although good appeals that government must sort out the confusion with the regulations with over 100 cases, it's very costly to continue defending it in court. We all have a duty to protect each other. Many led by examples such as the faith community that jumped into action to close places of worship during the phase of rising infections. Where would we be without the nurses, doctors, police and prison warders, the cleaners, garbage collectors, drivers and grocery store workers? It is these brave frontline workers who have continued to keep the country and our healthcare systems operational during the lockdown. They are our unsung heroes. We must also acknowledge the teachers who are placing themselves and their families at risk by going back to work to see to the education of our next generation. If we don't learn we are doomed, and time South Africa was caught up in such a fast-moving pandemic was 100 years ago. When the Spanish flu touched down from Europe, those in power over this country did not take enough preventative action, and South Africa became one of the worst affected countries in the world. Between 200 and 350,000 South Africans died in a few months. We don't know the exact figures because the deaths of black people were not well documented. But what we do know from this bitter experience, and medical experts across the world agree, is that allowing such a virus to run free in our communities until so many people are infected that it stops spreading this wrong approach. Good continues to advocate that we stay safe, follow the rules, wear masks, sanitize, and make as little contact with those, particularly our elderly, who are most vulnerable. By staying safe, we can keep our loved ones safe. Thank you.
Thank you, and be safe, Honorable August. Honorable Sheikh Imam.
Thank you, Deputy Speaker. The National Freedom Party wants to extend its disappointment, first of all, in the manner in which we are dealing with the pandemic before us. Let me start off at the same time by acknowledging the role that the Minister and the Department is playing in trying to fight this pandemic. But I think that is not good enough, Deputy Speaker. It appears currently that lives do not matter. A very great percentage of those people that are dying is because of comorbidities, lifestyle diseases, diabetes being one of the major causes. And instead of trying to put in measures to ensure that we improve the quality of life and the lifestyle of our people, it appears that it is all about profits, it's all about money. Now let me say this, Deputy Speaker. I remember we discussed this matter and said we will have a district approach based on the hotspots. I remember there were political parties that came up and said we want the entire economy to open. The Western Cape was one of them that demanded that. They even went on to say, no, it's not 3, we want to go to level 2 and 1. And all I want to ask, and yes, indeed, we have problems nationally, let us not run away from that. But just give me one example, just one. What did you do in the Western Cape to keep those numbers low, to make sure there was a high compliance? You gave us an assurance, and I'm saying this because I'm based here at the moment. You gave us the assurance that you will make sure you will put measures if we ease the regulations. Have you done that? No, you have not done that. Come with me, because I don't know where you live in, which world you live in. Come with me and I will show you on the streets of this Western Cape, in the townships, nothing can be seen. You know, our people are dying, they are being infected every day. But you are looking for faults rather than saying, yes, indeed, we too haven't done enough. And yes, you haven't done enough. Now, you know the issue of schools. We said this from the beginning, that no, we cannot send the children to school. It is not safe. Now when the infections are high, we are saying, let's send them to school. You know, you are finding excuses. How many of your educators have tested positive? How many have died? How many of those learners have tested positive? How many of those schools you haven't given those facilities to? Can we rather put the lives of our people? We didn't have a problem with opening the economy, but simultaneously there needed to be a balance to save those lives and prevent those infections. But clearly it is not about lives, it's about profits, it's about economies. You know, it's as good as saying to somebody, and I'll give you a good example, alcohol. You know it's a poison, it's destroying this nation, but you are fighting to open it up and allow the alcohol. You are fighting for the tobacco, even though you know it's going to destroy our people. Is it all about profits? Is it all about money? Or can we now at least become human to at least care about the people on the ground first? We can balance it if we want to. You don't want to balance it. It's all about profit, and it's disappointing to hear people come here and only talk about money and the economy, but don't want to balance it. It is very disappointing. Thank you very much.
Thank you, Honorable Member. Let's have Honorable Hendrikse Al-Jama.
Honorable Deputy Speaker, can we allow the Honorable Majisha to speak first? And I just wanted us to check if Honorable Njaisa is not there or Honorable Gallo, because their patch is empty. They don't have a name. Honorable Gallo?
Yes, that's why. Yeah, okay. No, that's fine.
Okay, let me, Honorable Majisha, go. Thank you.
Thank you, Honorable Chairperson and Deputy Speaker.
Thank you, sir.
Without doubt, we are all agreed that COVID is a national problem. We all know that it is a global problem. It kills the young and the old, the working class and the poor, the rich and the wealthiest. It chooses no color at all. It is against this background that COPE ululated when our country's president convened leaders of all political parties and together with them announced a resolution to declare COVID a national crisis. There is, I must say, a problem where people have reason to say in this province things are worse, in that other province things are better. That is not true. I think in that way we have become limited insofar as our thinking capacity is concerned. South Africa is a unitary state, it's one government. You therefore can say, in the Western Cape, things are like this, in the other province, things are like this. We are wrong if we come up with that kind of a situation. The Western Cape is part of South Africa. Gauteng is South Africa, etc. I think we need to emphasize that particular thing, so that if we rise and say we are having more problems in Gauteng and we are having lesser problems in the Western Cape, or we are having more problems in the Western Cape, lesser problems in Limpopo, then we are going to be landing in a very serious problem. We are one country, and I therefore want to emphasize, please emphasize, that Western Cape must be seen, understood, it's one of South Africa, and we must move from that particular position. It is unfortunate further that the crisis now is being used as a government, or by the government as a campaign, a tool. I call on South Africans never to forget this, because yes, we said all South Africans, all political parties were moving from this particular position together so that we can save all South Africans. But now it's been twisted and used as a political tool for some to achieve that which they want to achieve. Now, on the other side, there are other problems where we're having institutional weaknesses that make COVID-19 response a real opportunity for government criminals to capitalize on the situation. The controversial purchase of blankets, of sanitizers, of soap, other hygiene products totaling 40 million rand by the KZN Social Development Department is a clear indication of the risk. We're having very serious problems, not in one area, but in all the areas of the country. The media, for example, has reported on alleged incidents of theft of food parcels by councillors, as well as instances of councillors allocating food parcels to their relatives or members of their own political constituencies. Now that needs to be looked into by yourselves here as members of parliament. We want to accept and say that what has happened in the Northwest is very painful. The Premier there has reason to say, I am in this kind of a situation. The MEC has died. 2 hours ago, the Premier in the Western Cape rose to say, I too am affected. The other people all over the country, even in this parliament, have reason to say, I am infected. I say those who have recovered, you have done well. But as I sit down, my dear chairperson, know that South Africa is one country. Please do. Thank you.
Thank you very much. Is there anybody from the PAC? Is Honorable Janso there? If he's not there, let's move to Al-Jama.
Thank you very much, Honorable Deputy Speaker, Honorable Minister of Health. Al-Jama would like to thank you, especially on behalf of the Muslim community, for your leadership during this pandemic. We also thank the ruling party for mandating one of the best in its ranks to save lives. Deaths from COVID-19 in the Muslim community is 4 times of what it should be in terms of the demographics, worse than it was during the Spanish flu in 1918. There are 300 Muslim deaths, 10% of the total deaths in South Africa, while the Muslim population is 2%. Al-Jama wants to use this opportunity to appeal to the Muslim community and all South Africans to embrace the key preventative measures the Minister of Health talks about every week during the past 104 days. It is a matter of faith and a jihad for Muslims to keep social distance, wear masks and wash their hands regularly and stay at home, especially our elders with health conditions. Muslims must not break away from the shura of Muslim leaders that we must follow the orders of a commander-in-chief as we are in a war. I saw the messages of the Minister of Health being obeyed when I buried my aunt Hamida Huli Esop an hour ago. A virtual funeral service was held, there was social distance and the gathering was less than 30 at home and at the graveyard. This is what my aunt would have wanted as an activist after the treason trial, when she, my mom and her friend Janie Halim took sandwiches to resistant fighters hiding in District 6 and Ilanga. What they gave us is the freedom we enjoy today. This is what the Minister of Health asked us to do, and his leadership will give us life to continue to enjoy the freedoms so many fought hard for. Al-Jama wants to tell the Minister that he will leave a legacy behind that matches the proud legacy of Chief Albert Lutuli, Robert Chibukwe, Imam Abdullah Harun, and Nelson and Winnie Mandela, and we are very proud of him and the Portfolio Committee of Health, which must speed up the rollout of the NSI. Thank you very much, Honourable Deputy Speaker.
Thank you very much, Honourable Member. Let's call the Chairperson, Honourable Dlomo.
Thank you very much.
Okay, good.
Thank you very much, Honourable Deputy Speaker, and the privilege to really address this House. Let me say from the onset that the severe acute respiratory syndrome, coronavirus 2, that has caused this COVID-19 has really wreaked havoc in our lives, in the world and in our country. I would like to take this opportunity to start by thanking our healthcare workers out there who are doing a sterling work and face hard risk, but nevertheless they soldier on. Thank our Minister Mkhize and his entire team that leads this excellent work in our country against COVID-19. Extend our thanks to the President, who actually is leading from the front in providing guidance on this COVID-19. What next then, in the light of so much information that we have? What then do we really need to do? I shared this when I discussed with the chairperson of the team that is advising the Minister, Professor Abdul Karim Slim, yesterday, and he gave me a snippet of what he has written. He has written a story which is ending by these words: "Dear grandparents and our parents, I'm asking you to please look after yourselves. Do not mingle too much. You are too high a risk. Just stay at home alone, at least until end of September, October, when we should be seeing a decrease in the figures." That is what I really learned from him. This morning, we had a meeting as a portfolio committee with the Department of Health. I took an opportunity to speak to Professor Glenda Gray after the meeting, and among other things she educated me on was to say COVID-19 will not be defeated in hospitals. COVID-19 will be defeated in communities by ourselves. the hospitals will just see the complicating cases of the COVID-19. Now, I will touch on what actually has been said by WHO, that they are still to confirm whether COVID-19 is airborne. Whether it is or not airborne, I would therefore want us to engage ourselves in saying, with all the things that we have been asked to do, let us please wear a mask. When I wear a mask in public or decline an invitation to a party or to come inside the house, I would want you to know that I have been educated enough or counseled enough to know that I could be without symptoms but still be able to give you a virus. No, no, no. I do not live in fear of the virus. I just want to be part of the solution, not the problem. I do not feel the government is controlling me. I feel I'm being a contributing adult to society, and I want us to teach others the same. The world does not revolve around me. It is not all about me, but it is not about my comfort. If we all could live with other people's consideration in mind, the whole world would be a better place, maybe also including gender-based violence. Therefore, wearing a mask does not make me weak or stupid or even controlled. It makes me being considerate. When you think about how you look, how uncomfortable you are on the mask, just imagine someone close to you choking in a respirator alone without any family member allowed at the bedside. Therefore, wearing a mask is not a political issue. It is being responsible. I'm also comforted when I read what the President writes on his weekly articles about this matter, because this issue of a mask and the address on comorbidities and our elderly people speaks to that. We are actually impressed by what the department has done now that they are focusing on the last 5, 6, and 7, 8 of the steps that the WHO has actually prescribed for them. And the minister has actually alluded to that. Now, currently the department is scaling up the intervention of targeted screening and testing and ensuring health facilities readiness in the hotspot districts. For the facility readiness component, they are working with the relevant authorities to ensure that there are sufficient hospital beds, ventilators with oxygen, adequate workforce and PPE supplies in place. We are grateful to know that even though as of the 4th of July, we have admitted about 36%, 2,535 patients in Gauteng, Western Cape 27%, and KwaZulu-Natal 14%. Most of these patients are still kept in the general wards. Only 12.5% are admitted in the ICU. And that is actually, and then of those in the ICU, 43.5% are on ventilation. I would like to stress the following measures that are key, that we must avoid actually close contact with people suffering from the acute respiratory infections. We must wear this cloth mask, ensure frequent hand washing using soap. When sneezing and coughing, one should cover their nose and mouth. Most importantly, seek medical attention in case of symptoms suggestive of respiratory illness. It should be noted that South Africa, through the Department of Health and its partners, are doing all they can effectively respond to the scourge of the global COVID-19 pandemic. In the recent visits by the Portfolio Committee to the 4 provinces that are heavily burdened by COVID-19, that is Western Cape, Gauteng, KwaZulu-Natal, and Eastern Cape, we note the progress and the challenges that the department is facing. Maybe, let me just say, to the PPE, Minister Mkhize, we are grateful that you have actually encouraged some of the hospitals to include in their PPE committees workers' representatives, because that on its own goes a long way towards removing complaints and unhappiness, and also gives an orientation to healthcare workers. Which healthcare worker must use which type of a PPE, because it's not all of them wearing the same. We are not really happy about the progress that has been made on the infrastructure, especially in the Eastern Cape. If you note that there is around Umtata Airport, there are hangars there that were identified to actually be field hospitals, and the progress that has been made there is not very impressive, especially because there is an issue of a chief director infrastructure that has not been completed in that area. The shortage of staff is a problem. When COVID-19 comes in, it exposes that even much more. I hope that we should not become pessimistic, as some of the honorable members have come into this podium have said, and virtually too. We are asked to add our contribution to the already programs that are there in place. I don't know whether some of the honorable members are living in another world, because South Africa has actually been asked by the WHO to come in and present what were our success stories. I don't know where we were sleeping, because amongst the challenges that we have in the world, South Africa has been pioneered, has actually been elevated as one of those countries that are doing exceptionally very well. There's an honorable member here who has asked that the minister must consider administration in the Eastern Cape. Maybe we should have asked that we start with the Western Cape, because the problems that we find in the Eastern Cape were transported from the Western Cape. It is the collapse of the system here that made us to suffer what we are suffering in the Eastern Cape. Number two,
I can't believe it.
Number two, this Western Cape is currently benefiting from the world experts
so much for not politicizing issues.
And we should actually stop politicizing this and actually see the minister spreading across all. Don't come and call for administration in the Eastern Cape when the Western Cape started the problems. The world experts who are specialists, and those are Cubans, are all over the country, even supporting the Western Cape, the very same province that did not see that there was a need to have such specialists. In fact, I think what this should actually educate all of us is that we should be moving towards national health insurance. You call your members who started the call. I didn't make a call. This Honorable Kwahube made a call about Eastern Cape. We are not politicizing issues. She should have stopped not to talk about Eastern Cape to be put under administration. Start in the Western Cape. But NHI is going to be the key to all the challenges that we face in the country. Thank you very much.
Finally, tell them.
Thank you, honorable member. All the honorable members, let's ask the minister. It's your turn to close the meeting, sir.
Thank you very much, Deputy Speaker. Let me thank all the members who have made a contribution in this debate. And let me also just convey my own condolences to the family of MEC Kehakilwe, as well as our health workers, whom we have lost in this battle against COVID-19. And we do want to say again that at this point, more than dividing us, the fight against COVID-19 should unite us. We came to make the statement because we believe that out of the contributions, the members will help us to look at some of the blind spots and be able to come with suggestions that we are always glad to consider, because in this case, in this fight, there is no one part or person that possesses the monopoly of wisdom. So we have taken into account a number of comments that have been made, and we will be considering a number of them. Currently, we take a lot of advice from the doctors, the nurses, the specialists, the experts who treat the same patients, who understand the disease, and therefore give us ideas of what needs to be done so that we can control the spread of the infection. At this point, we have this Ministerial Advisory Committee sitting and going through a number of issues that we have said that they need to relook at quite seriously. The issue, for example, of the alcohol and the restrictions, how intermittently this can be implemented so that we can avoid the pressure from the trauma on the casualty wards and ICUs and so on. We've asked them to look into those issues. We've also asked them to evaluate the lockdown in terms of to what extent that lockdown that we went through benefited us, at what extent we might need to introduce that. And the general feeling all along has been a concern that we need to keep a very fine balance between livelihoods and lives. In this case, we want to make sure that we prevent our people from dying and being infected by the coronavirus, but at the same time save them from the catastrophic effect of a declining economy, starvation, and loss of income. And we do understand that we will come to a point where we might disagree, but I think the major focus has to be our people. And therefore, the government is approaching this matter from a point of view that says we have to balance the lives and the livelihoods. And President Ramaphosa has been always emphasizing this point, because it's not a choice of either or. It's a matter of how do we make sure we get the best from both. And therefore, the point that's been raised by Honorable Jomo is the correct approach. At the end of the day, this battle is going to be fought and won in the community, because the issue that is critical is about the prevention, behavioral change, making sure people wear masks, and making sure that we emphasize hand washing, sanitizers, cough etiquettes, and so on. What I would appeal to all the members here is, rather than throwing missiles at each other, we should use our energies to go to our constituencies and then promote this behavioral change. If we go out to every ward, every district, every church, every mosque, every school, every community, and encourage people to take very seriously the issue or the message of wearing the masks, then we'll be able to make a huge dent on this infection. The countries that have been successful in the world are those who are able to successfully implement the change of behavior, and therefore we need to try and avoid taking the issue of COVID-19 to be a political football. At this point, we have taken an approach that will support all the provinces. Similarly, there were lots of weaknesses in the Western Cape. We went there and we sat with them. We made sure that we correct a number of things. For example, the issue of contact tracing was literally, non-functional. We have worked on it, and we have now got to deal with the community whom are also reluctant to come in for quarantine. But we don't believe it's correct for anybody to single out Western Cape for any reason, either as a demonstration of any partisan kind of performance. Similarly, in Gauteng, they did well on the side of contact tracing at the beginning, and therefore they benefited for a long time from the lockdown and the fact that their contacts were quarantined. But of late, we can see that the weakness has been on the numbers of people who are rising, of positive cases versus the numbers of beds that we have available. This, again, means that we must work with the Gauteng, as I'm currently doing, to make sure that for all the provinces, Eastern Cape included, we provide for additional beds, provide for additional human resources, oxygen, and all the support that they need. But most important for us is to be able to ensure that the communities must be given the opportunity to appreciate the role that they can play in defeating this scourge. In this case, I think that we need to understand as well that there are weaknesses in all the provinces. So no, Honorable Kwahube, we have not come to take a decision on putting Eastern Cape under administration. We have not done so in the Gauteng, we have not done so in the Western Cape. It is true that each one of those have got their own weaknesses, but they're all weaknesses of one and the same system. And therefore, we are looking at all the things that need to be done to strengthen this situation. We must also say that everything that we're doing is all for the people of South Africa. particularly the majority, particularly the poor, particularly the black people who will bear the brunt of this pandemic. We have actually gone into the issue of racial profiling. We found that many of the people don't put this as their classification when they fill the forms, and the doctors also do not. So the information is incomplete. But I think from the point of view of the EFF, it is important not to be misled. However, you might be feeling strong, be aware that when the lockdown was put in place, it was to protect the majority of the people, most of whom are black. When the social grants were increased, that was to assist to support particularly the black and the poor communities. When there was unemployment grant put in place, it was to assist the black people in particular. The majority of the people were screened. The 20 million were screened were majority black people. The 1.9 million tests that were done is majority black people. The additional field hospital, the oxygen, the additional human resources are going to be serving the black people. And therefore, we must not start to divide our people on the basis of race when we do know that inequality, unemployment, and the history of poverty has actually affected the majority of our people who have a legacy of having inherited lower level health services because of the history of apartheid, and therefore we cannot really play too much into that and create a division amongst all our people. It's also important for us to say it's important to support and protect the workers, particularly with the provision of the PPEs, and the idea of working with unions we found to be very, very useful. So those who felt that acting as whistleblowers was giving them any backlashes, as members of parliament, please report to me so I can investigate those. We were investigating a number of incidences which are unacceptable. The case of a child who was reportedly raped in isolation is a very unacceptable situation, and in fact we do want to get to the bottom of that. Similarly, the case of the patient who reported that he had not been fed for 48 hours, we have asked our ombudsperson to go into details because we have already picked up preliminary reports, something that we think that needs to be properly investigated. So all of these issues for us are very, very critical. I think when we sit here as South African leaders, we must always remember that fighting amongst ourselves has got its place. But in terms of dealing with the pandemic that's facing the whole country, all of us have to be working together. COVID-19 is going to be with us for the rest of this year and next year, and therefore it's important for us to know that we must begin to adjust, returning to economic activity under new conditions, returning to school under new conditions. Yes, certainly there will be interruptions. There will be instances where we might be forced to close down the schools. We might be forced to defer the timetable for writing exams. We may be forced to bring in additional restrictions, as we have said, in a differentiated approach. All of those, we must be open-minded about them. We've seen many countries lifting off the lockdown and reimposing it a few weeks later. So we will not be different. We will play on the basis of what we think is the best evidence available to help us to stem the tide of COVID-19. At the moment, I think we do have to always make sure that we work together and send the same message to all the people of South Africa that prevention is one of our major ammunition in fighting COVID-19. And therefore, as we walk around in different provinces, we have seen that there are different manifestations of this infection. We will continue to give support to all of them. We're discussing today the issue of oxygen with some of the companies that provide. We will make sure that this oxygen is made available for all the people. We will also be strengthening, even in some of the areas where we had not thought it was necessary to put up the beds, we are going to actually increase them. At the beginning, when we thought the infection was going to land up quicker, we had actually reduced the occupants of the hospitals and put up people on 3-monthly supply of scripts for their medication, because we wanted to protect those with comorbidities. And we want to also send that message to those who are senior citizens that they need to protect themselves. And all of this is part of trying to fight against COVID-19. At the end of the day, you are welcome to give us suggestions. At the end of the day, we have to learn as we see our successes, and when there are failures, we're prepared to make amends. Thank you very much.
Thank you very much, Minister. That concludes responses to the statement, including by the Minister himself. The Secretary will read the next order.
Consideration of report of Standing Committee on Finance on revised fiscal framework and revenue proposals for 2020-2021.
All right, so that's how we come out of that parliamentary proceeding where the Minister of Health, Dr. Zweli Mkhize, was making a statement on the impact of COVID-19 in the country. We had a number of leaders from the different political parties represented in Parliament also putting through their statements, putting through their arguments, and just in conclusion, the Minister responding to some of those arguments. So we'll certainly be reflecting on that in the next hour here on the show. But
the Minister of Finance tabled the 2020 Special Adjustment Budget on the 24th of June 2020. Section 30, subsection 2 of the PFMA empowers the Minister of Finance to table an adjustment budget when fiscal targets are compromised by significant and unforeseeable financial and economic events. A combination of pre- and post-COVID-19 economic deterioration, credit downgrades, and widening fiscal deficit has made the 2020 budget fiscal target unattainable. The adjustment is necessary to mitigate the downside of COVID-19 healthcare, socio-economic, and financial risks. Government is forced to make drastic changes to the budget within a short period of time. The Speaker has since referred the adjustment budget and the accompanying bills to the committees responsible for finance. It is against this background that the Standing Committee on Finance had to engage with this process. The Standing Committee on Finance, jointly with the Select Committee on Finance of the NCOP, received a briefing from Treasury as to what is this special adjustment all about. As a committee, we advertise for the public to make submissions. And indeed, the public through different NGOs, business, and different entities made submissions, and we allocated a day for them to come and make a public, allocated a day for public hearings where they were allowed to make submissions orally. So we did receive oral submissions and written submissions. We are tabling this report at a time when COVID-19 pandemic has caused unprecedented damage to the socio-economic lives of people all over the world. As the health and human toll grows, the economic damage is already evident and represents the largest economic shock the world has ever experienced in decades. The global and local economic growth outlook is grim. According to the June 2020 Global Economic Prospects, the baseline forecasts estimate a 5.2% contraction in the global GDP, the deepest global recession in decades. Advanced economies
are projected to shrink by 7%. That weakness will spill over to the outlook for developing economies. Most countries are expected to face recession in 2020. Developing economies will be buffeted by economic headwinds from multiple quarters. They will face problems in regard to the loss of trade, tourism, dwindling remittances, subdued capital flows, tight financial conditions, and mounting debts. In South Africa, GDP growth in 2020 will contract significantly. According to National Treasury prediction, the economy will contract by 7.2%. The growth forecast of 2.6% appears to be too optimistic given the uncertainty and the impact of the COVID-19 crisis on economic activity. The deteriorating fiscal position will increase the cost of borrowing and further worsen debt sustainability. South Africa may also be unable to raise funds to meet its borrowing requirements. Currently, every rand that South Africans pays in tax, 21 cents goes to paying the interest on past debts. This excludes the repayment of the debt. Deficit reduction and debt stabilization targets are becoming increasingly elusive, leaving South Africa with limited fiscal space. Unemployment is rising. According to Stats SA Quarter Labor Force Survey, 38 jobs were lost in Q1 in 2020, with the addition of 306,000 entrants in the same quarter unable to find jobs in the labor market. Hence, the total estimated unemployment has increased by 344,000. Care inflation, which includes food, non-alcoholic beverages, clothing and footwear, housing and utilities, health, public transport, communication and education items, saw a higher price inflation during the COVID-19 pandemic. Even prior to COVID-19, slow growth had impacted on government revenues, leading to a rising deficit and debt. COVID-19 has further exacerbated these challenges, with fiscal space further deteriorating and estimates showing that there will be a main budget deficit. Observations and recommendations. We believe that the state should play a critical role to intervene in the process of reconstruction and economic recovery. It is time for firm and caring state to intervene. The state is the anchor during these difficult and uncertain times. Government should stimulate the economy to grow, offset the losses associated with COVID-19, and increase economic activity. It is a fallacy, Deputy Speaker, that those who believe in the market forces and don't believe in the state intervention, that in a critical era like this, it is the role of the state to play a very critical role. When there is financial turmoil, the state should intervene decisively. During the 2008 crisis, we saw governments all over the world playing active role in the economy, be it in the UK, Belgium, Germany, Netherlands, islands, in the Southeast Asia, etc. Also, We have seen America, the USA, intervening when the market failed. You'll remember the problem of the Lehman Brothers. You'll remember the issue of AIG and the General Motors. When the General Motors had serious financial difficulties, the state of America intervened and bailed out General Motors with 11.2 billion US dollars. So it is incorrect to say that the state should not play a role. It's never happened anywhere in the world, and all over the world, we see states playing very critical role in the economy. Expenditure should be targeted to help the poor households and SMEs. We expect SOEs to be the anchor of the developmental state by playing a critical role in the reconstruction and economic recovery program. The state has to intervene, as I've said before. It is very important for government to intervene so as to achieve a more equitable distribution of income and wealth. There's no way in which market forces can distribute income and wealth. The committee believes also that industrialization and localization should become key pillars of the inclusive economic recovery. The minister also should brief the committee on the implications and the terms of any loan from financial institutions, as we heard the minister saying he will be approaching multilateral financial institutions. We believe that the loan will not be dollar denominated, because that will come at the expense of our country. We also believe that it is crucial for the PIC to consider the possibility of making funds available for the funding of long-term projects. The South African Reserve Bank should consider the feasibility of purchasing government bonds in order to stabilize capital markets and boost liquidity. There is more policy space for the South African Reserve Bank to act to ensure liquidity and stimulate the economy. Economic stimulation must be at the center of debt reduction strategy, since inadequate revenue is the largest driver of the burgeoning deficit. In terms of the focus by South African, the SARS receiver of revenue, they are focusing a less collection of or decline of almost 304 billion rand of revenue. That will come at a huge cost to government, more especially the poor, because it might end up affecting NSFAS, social grants, and a whole range of other subsidies that government provide to the poor. We call upon all spheres of government to submit operable plans for revenue enhancement and expenditure management. We should also look at considering unlocking domestic investment through impact investments and Regulation 28 of the pension fund. By so saying, Honorable Deputy Speaker, the committee had adopted the report, and what I will say is that, of course, there were minority opinion, but majority of members of the committee adopted the report. I therefore move, Honorable Speaker, that the report be adopted. We can see in call.
Small but enthusiastic crowd.
Deputy Speaker?
Yes, ma'am.
Then
I called for Honorable Louis.
you were muted.
Is he not hearing?
You were
Honorable Gigi
muted.
Louis. Oh, okay.
Thank you very much, Deputy Speaker. Deputy Speaker, the discussion around the emergency budget the last 2 weeks has been centered on a series of non-debates and false choices that should be knocked on the head. And in the time available today, I will try to address 4 of these. Firstly is the idea that we should just be borrowing as much as we want. The truth is that if we do not get debt and debt service costs under control in the next few years, we will have a sovereign debt crisis in South Africa. A sovereign debt crisis will have horrific consequences for the poor and the marginalized in our society. So no one should ever suggest, as some people have in the last 2 weeks, that this is actually a good outcome. And all of us should do whatever it takes to avoid that outcome. Just as the Minister of Health was calling